Hello, in this video we will demonstrate the correct technique for performing venous blood sampling. Although it's a routine procedure in many clinical settings, attention to detail is key to obtaining a good quality sample and maintaining patient comfort. I'll talk you through each step, highlighting practical tips and best practice as we go. Prior to taking a venous sample, it's important to prepare your area and your consumables. The consumables that you'll need are gloves, an alcohol swab, a tourniquet, a safety needle, some lint-free gauze or cotton wool, a blood collection tube. You may also need a plaster if the patient requests one. Remember to check for allergies. You will also need a sharps bin and a clinical waste bin. Okay, so you've got the arm in the correct position with the palm facing up. You're putting the tourniquet around on the arm. You're looking at 8 to 10 centimeters from the elbow crease. So put the tourniquet on, placing the button on the same side as the hand that you're going to be taking it off with. So in this case, the phlebotomist is right-handed, so they'll be placing the button on the left because that's going to be the hand for removing it. Now you're going to look for the vein. To do this, you're going to palpate the arm and find a nice, bouncy, straightish vein, which is nicely refillable. You now need to grab a swab and swab the area in a circular motion, going from the inside to the out. Next, we are going to get the safety needle and we're going to take the seal off. Then we're going to pull back the cap and remove it. Then we're going to anchor the vein and go in with the needle. I would also recommend warning the patient at that time. When we go in, we're looking at a 15 to 30 degree anchor angle, and here the phlebotomist supports the needle with the 3 fingers underneath, which naturally gives them that correct angle. Some needles offer a flashback facility, as you can see here. So once you get that flashback, you can pop the blood tube on. Once the tube begins to fill, you can release the tourniquet. Next, you can remove the bottle. Invert it 8 to 10 times, as per the manufacturer's instructions. Get a gauze and place it over the needle without applying pressure. Remove the needle and cap immediately and apply gentle pressure to the site of the needle, and if appropriate, ask the patient to apply pressure. Finally, place the needle into the sharps bin and ask the patient if they would like a plaster, remembering to check for allergies.